Sanjiao 2 between the 4th and 5th fingers, half a cun within the web margin. So bring the 2 fingers away from each other, feel for the flare of the bone of the 4th, and come out into the margin between those 2 bones. Sanjiao 4, which is on the dorsum of the wrist, in between 2 tendons, extensor digitorum communis and extensor digiti minimi. I'm popping my point in. Sanjiao 11 is 1 cun superior to Sanjiao 10. Sanjiao 13 is located on a line connecting Sanjiao 10 to Sanjiao 14 at the posterior border of the deltoid.
Small intestine 6 is located in a groove in the high point of the styloid process of the ulna. To find this groove, rotate the arm up onto the body. When you do this, you'll find that a tendon moves out of the way to reveal a nice groove in the bone. Be careful not to come too far radial or you will come off the bone completely. Actually find this point level with the high point of the styloid process, but in that groove.
Large intestine 13 is 3 cun superior to large intestine 11. It's between the lateral borders of biceps brachii and the shaft of the humerus. If you divide the distance between the anterior axillary fold and large intestine 11 into thirds, the point just lies there. Heart 2 is 3 cun proximal to heart 3, in the groove medial to biceps brachii.
Spleen 3 is located in a depression which is proximal and inferior to the first metatarsophalangeal joint. Find the knuckle of the big toe and fall into a nice depression which is proximal and inferior to it. Be careful not to approach this point from this direction, or you may try and find it on the wrong side of muscle. This point lies between bone and muscle. Spleen 6 is located 3 cun superior to the medial malleolus, half a finger breadth posterior to the medial crest of the tibia. Be sure not to place this point actually on the bone. Kidney 8 is located half a cun anterior to kidney 7. First locate your kidney 3, move up 2 cun to find kidney 7, then move half a cun anterior to find your kidney 8. Kidney 8 is off of the medial border of the tibia. Stomach 31 is often described as being at the junction of a vertical line drawn through the anterior superior iliac spine and a horizontal line drawn through the greater trochanter. More importantly, it lays on the lateral aspect of the muscle sartorius. To bring this muscle into relief, have the person cross their legs. It should now be possible to palpate over sartorius and find a nice depression lateral to it. When the person brings their leg back to a resting position, you will find that this point may not lie exactly on where those two lines join. Stomach 32 is located 6 and superior to the superior border of the patella on a line joining the lateral border of the patella to the anterior superior iliac spine. If you divide the distance between the superior aspect of the patella and the prominence of the greater trochanter into 3 equal parts, this point will lie just a little more proximal than the lower third. Stomach 33 is 3 sun superior to the superior border of the patella on a line joining the lateral aspect of the patella to the anterior superior iliac spine. It's half the distance between the superior border of the patella and stomach 32. This is stomach 33. Stomach 34 is located 2 sun superior to the superior border of the patella on a line joining the lateral aspect of the patella to the anterior superior iliac spine. As the patella itself is 2 sun long, we can use this measurement to help find this point. Another useful tip is to have the person press their leg down into the bed. This point will be found in a nice cleft at the inferior border of vastus lateralis. Stomach 35 is located on the lateral aspect of the knee when the leg is flexed. It's on a level with the inferior border of the patella and lateral to the patellar ligament. Stomach 37 is located 10 sun superior to the prominence of the lateral malleolus, 1 finger breadth lateral to the anterior crest of the tibia. Remember to use the breadth of your patient's finger, not your own. Stomach 39 is located 7 sun superior to the prominence of the lateral malleolus, 1 finger breadth lateral to the anterior crest of the tibia. Remember to use the width of the body's finger, not your own. This point therefore lies inferior and anterior to stomach 40. Stomach 40 is located 8 sun superior to the prominence of the lateral malleolus, 2 finger breadths lateral to the anterior crest of the tibia. To locate the anterior crest of the tibia, place your 2 fingers along the anterior part of the leg and feel for the bony ridge. Remember, when you measure 2 finger breadths lateral, they're not your own finger breadths, they're the size of your model's finger. These fingers are smaller than mine, so when I mark this point, I will make sure that the marks are closer to the anterior crest of the tibia than the width of my 2 fingers. Stomach 41 is located on the anterior aspect of the ankle flexure. It's on a level with the prominence of the lateral malleolus. It is located in between the tendons of extensor hallucis longus and extensor digitorum longus. To reveal extensor hallucis longus, get the person to pull their toe up against resistance. Locate this point in a nice dip just lateral to that, actually in the ankle joint. Articulate the ankle to make sure you are actually in that joint. Liver 4 is located in a depression directly anterior to the prominence of the medial malleolus, but medial to the tendon of tibialis anterior. To bring this tendon into relief, dorsiflex the foot. So if you can relax. Don't confuse this point with spleen 5, which is much lower down. It's directly anterior to the prominence of the medial malleolus. Liver 6 is located 7 cm superior to the prominence of the medial malleolus, immediately posterior to the medial crest of the tibia. If you're having problems identifying the medial crest of the tibia, just raise the leg slightly so the flesh falls away. Gallbladder 31 is located directly inferior to the prominence of the greater trochanter, 7 cm superior to the inferior border of the patella. To find the prominence of the greater trochanter, press the hips on either side to feel for a bony protuberance. To double check that you've found the greater trochanter, rock the leg from side to side and feel the bony protuberance moving underneath your hand. The distance between the greater trochanter and the inferior border of the patella is 19 cm. If you divide this distance into 3 equal units, each one of these units will be 1/6 of a cm. As the point we're after is 7 cm superior to the inferior border of the patella, it lays just a little above the superior border of the lower third. Gallbladder 32 is located on the lateral side of the thigh, 5 cm superior to the inferior border of the patella. If we divide the distance between the inferior border of the patella and the prominence of the greater trochanter into 4 equal parts, this point lies just a little higher than the junction of the inferior quarter and superior 3/4. Gallbladder 33 is located on the lateral aspect of the knee, in between the tendon of biceps femoris and the lateral epicondyle of the femur. To bring the tendon of biceps femoris into relief, have the person pull their heel back against the bed. You should be able to feel this tendon quite clearly now. When the person relaxes their leg, you should find this depression more or less on the same height as the superior border of the patella.